especially to Dr. Arun Kumar and distinguished members of AINU team and other colleagues and members of press. It's exciting to embark on this new partnership with AINU. My name is Sanjai Murali and I'm the founder and CEO of JOGO Health. Mayo Clinic is one of our backers. They are an investor in the company. We also came out of few innovation programs, Johnson & Johnson, M2B2, as well as Brigham and Women's Hospital. So this has been a therapy that's been decades in the making. So Dr. Joe Brutney is one of the brains behind this therapy. He is a neurologist and a physiatrist. And the story is that he escaped the Holocaust in Germany during World War II, came to New York, and this is the time when physical medicine and rehab was becoming started, because there was a lot of veterans with polytrauma, a lot of brain injuries, for which no treatment existed. So he came up with this whole idea of using what's known as EMG Biofeedback to help re-educate the brain to get control over the muscles. So on his own, he teamed up with Dr. Gordon Silverman, whom you see here in the color picture, and they built one of the first machines with IBM's help, and it was very, very successful. This is the big machine he had built. However, he was very passionate. He could spend long hours to set the machine and treat patients who had excellent improvements. But this was not commercially viable because it was very expensive, very time consuming. So my background is in technology, and so I helped shrink the big machine into a very, very small, portable, easy to set up machine. Whereas before it used to take 40 minutes to get it going, now it takes about 2 minutes. So it took us about 6 years to build this technology. EMG is not a very easy signal to work with, to get good level of accuracy and readability, and to make it work reliably across different pathologies. It took us a lot of time. But once we got it working, clinicians absolutely loved it because they had seen, heard about this, studied about this, but there was no easy to use technology to put it to use in different use cases. So how does this work? So to give you a simple example, you've heard about Pavlov's dog, the Russian scientist who trained the dog with a bell and a bone. So he would ring the bell and give the dog a bone. So the dog's brain got conditioned expecting a bone every time the bell was rung. So this is a very crude way of explaining operant conditioning. It's a learned behavior. And by giving real-time feedback to the brain of what the muscle has done in EMG, the brain can be retrained to regain control over the muscles that it has lost control of. So pictorially represented here. So imagine a stroke patient with insult injury to the brain, and the two nodes don't communicate. Through this feedback, it's creating two alternate pathways above and below the area of insult, just for illustrative purposes. And now the signals can travel back and forth between the two nodes. Another simple illustration is there's metro construction going in Chennai, so there's a lot of diversion of traffic. So you can think of these new pathways as being created because of this metro work as new pathways that help you travel from one point in the city to another point. So that's exactly what this treatment does. It's non-invasive. There's enough evidence to show that this works across a variety of disease indications. It's very, very successful. So this is an fMRI study done on patients with stress urinary incontinence. Whereas before the treatment, which is the picture on the left, you see that the additional somatomotor areas in the brain are lighting up. You see the red points in the imaging. After the biofeedback treatment, that has disappeared because of the learned behavior and automation of the new skill of controlling the muscle. All those red spots have disappeared, and the patient has recovered from stress urinary incontinence. So there's enough evidence to prove that this thing works, and this is what we have created, a very, very easy way to deliver treatment to patients with these conditions. We've done a number of studies. These are patients, for example, with what's known as voiding dysfunction, or DESD. We've seen excellent results, and this has been published, presented at international forums like IUGA and OGS. So 2 patients in particular I just want to highlight. These are patients from Chennai that we had the privilege of treating. Both patients had what's known as spina bifida condition. Patient number 1 presenting with voiding dysfunction. No treatment worked for this patient. It's a 30-year-old female bank employee using a catheter to void the urine. So imagine a bank employee going into the bathroom, putting a catheter to empty the bladder 5-6 times during the workday. Not easy. So that was her life. Never thought she was going to get married and have a normal life. But after 13 sessions of treatment, she's gotten rid of the catheter. She's able to void naturally. And the last I heard is a year ago, she found a good man, got married, having a very normal family life. Second patient's a 5-year-old male with stress incontinence, secondary to spina bifida, improved after 10 sessions of treatment. And both of these patients have discontinued these medications, leading very, very normal lives. So this is the impact we've had on these 2 patients who are like local to Chennai, local to Tamil Nadu. This treatment technique, biofeedback, is accepted as the first line of treatment in the Western countries, especially US, UK, etc., as well as Australia. And as I said before, there has not been an easy-to-use device where even doctors can prescribe and say, go have this treatment. So this is where we've come in, created a whole service layer around the technology that makes this very, very easy to consume and for patients to get better. So I've talked a lot about urinary incontinence, and that's the focus of our relationship with AINU. But besides urology, we're also very effective treating post-stroke disorders of movement, tremors due to Parkinson's, essential tremors, and also a lot of the chronic pain indications, cancer pain, chronic low back pain, migraine, etc. Also very, very effective treating gastro indications such as dysphagia, which is swallowing disorder, defecation disorders, and so on. So this is a patient whose video I'm going to share. We have permission to share. So she was 19 years old when she came to our clinic in Chennai. She came from Mumbai, had stroke at the age of 9 and ended up with what's known as focal dystonia, spasticity on the upper right arm. And you see how her right fingers are presenting versus the left fingers, which are very, very normal. And she had Botox treatment for about 9 years. So every 3 months she would go see a neurologist, get injected with Botox, and then she'd open up her right fingers. And after 3 or 4 months, the fingers would clench back like this. And she'll again go for a Botox injection. So this is on day 1 when she came into therapy. And you see how she's presenting. She can't fully stretch her right arm because of spasticity. Lots of pain on the right shoulder. Again, you can see how her fingers are presenting. And this is the biofeedback treatment with the JOGO unit hooked up to the patient. She's getting trained on how to relax those spastic muscles. And over an 8-week treatment period, she made amazing improvement. And this was the first time she was able to achieve this without a Botox injection. This is very, very exciting for neurologists. We complemented the biofeedback therapy with regular physical therapy. And this was the first time she was able to self-braid without the help of her mother. Very important for a young lady. And here you can see her doing a very smooth cylindrical grasp and release without the help of a Botox injection. So we followed up with this patient 6 months, 12 months, 18 months after the treatment. She's retained the improvements, doing very well. So this is the kind of impact we're able to bring with this therapy. Also have very good data with Parkinson tremors. We're able to control tremors voluntarily through the aid of this biofeedback treatment. And as you know, this is a very, very progressive condition. Neurologists keep on increasing the dosage because the tremors keep on increasing. And at some point, they cannot tolerate the dosage anymore. So they see this as an exciting adjuvant treatment. So along with the drug, you can give this biofeedback treatment and reduce the increase in the medication dosage. So it's better manageability over the lifetime of the patient. So in terms of pain, this is Dr. John Sarno, who worked with Dr. Joe Brodney at NYU. So he coined this term called neuroplastic pain, which was a very new concept in the 90s. That this is a pain not due to injury, but it's due to the pain circuits in the brain. So it was a very, very new concept. Nobody accepted it. It took about like 20 years for this to become more mainstream. Now it's really accepted that pain can be unlearned through this biofeedback mechanism. So there's something called central pain, which this treatment can impact. And this is also relevant in pelvic pain. We've seen very good results with chronic pelvic pain responding very well to biofeedback treatment. So this is a study on low back pain done at Harvard University, showing excellent results, pre and post. BPI severity is a gold standard for measuring pain, so we had excellent reduction in pain measured through BPI. Interestingly, although not a head-to-head comparison, with drugs like oxycodone and tapentadol, which are, used to be the go-to treatments, this is much better than these oxys, as they call them. Exciting for pain physicians. From a migraine perspective, again, excellent data. This study was led by Dr. Bernstein, one of the leading lights in migraine, one of the KOLs in this space, showing very good results in terms of reduction in disability, reduction in frequency, because we are able to reduce the triggers for migraine by training the patient's brain, how to respond to those. We have been lucky to build an excellent team, both in the US and in India, our medical advisory board, doctors come from Yale, Harvard, Columbia, etc. And they've really helped us not only create the protocol, the evidence, but also position this treatment vis-a-vis other treatments on the market. So these are academic medical centers in the US that are prescribing the JOGO treatment. So these are the top hospitals in the US: the Mayo Clinic, the UMass Memorial, Weill Cornell, Mount Sinai. And most often they have an older generation machine that's able to do the same thing, but that's never been used because it's very, very difficult to use. So that's why they see the JOGO technology as a game changer. We also been very lucky to get the endorsement and the acceptance from the leading hospitals, including AINU, for this treatment. And we're looking forward to working with the team here at AINU and make this a big success for the patients here. So with that, I want to thank the doctors here again for having us here today. and looking forward once again to making this a big success.